I'm going to be talking about ADHD today, what exactly it is, and the struggles that people face when they suffer from this very disabling disorder. So, to begin with, the features of ADHD include problems focusing on a task, very short attention span, wanting to be active all the time or walking around, feeling restless or uncomfortable when we are not allowed to do that, impulsiveness, where you can't think about the consequences or you don't think about the consequences when you take actions, disorganisation and problems prioritizing tasks, poor planning skills, poor time management skills, trouble multitasking when you have to do that, although you do try to multitask quite a lot with ADHD because there are so many thoughts going through your head all the time. Also, one of the issues that some patients do complain about is having a low frustration tolerance or very quick temper. It is considered a neurodevelopmental disorder, which means that people with ADHD, their brains are developed in slightly different way to the others. Hence the different terms like neurodiversity and neurodevelopment are used. Much to the surprise and disappointment of the people who suffer from ADHD, it is commonly still brushed aside by many, including the teachers, parents, colleagues, as an exaggeration of a perfectly normal non-condition where slightly hyperactive and naughty children are just labelled in the class as such by the medics. As in those who suffer from this sometimes disabling and often distressing condition, but also disheartening as they are denied treatment that can be of great help and transform lives. This is an attempt to illustrate the extent of hardships that many of the people who suffer from ADHD have faced just trying to get through a normal day at work. So what I'm going to do is talk about some of the history that I have got from patients about their past and present struggles. I will read out from one of my articles about a person's day at work or at home with regards to different aspects of ADHD. I started to write my 2,500 word essay assignment the day before submission was due. Having looked for my half-written notes from class, thinking of making a cup of coffee to help focus, wearing my noise-cancelling earphones, realized I had no clean clothes to wear to go to university, so got up to do that. So started collecting the clothes from my room floor, then remembered the coffee. On the way to switching my kettle, my friend texted. So by the time I got to the kitchen, I forgot what I was there for. I then returned to my laptop, which by now had run out of charge. My charger, as usual, was nowhere to be found. Looking for that in my room, which can only be described as a bomb site, took at least 1 hour, by which time I was hungry and wanted to eat. The fridge was empty, so had to make do with eating some old stale biscuits for lunch. Having returned to my laptop, which had now charged, I sat down only to notice other tabs on there. After 5 minutes of starting to read my research and notes and starting to type the first line, 5:30 p.m. had arrived. I had done about 150 words and the panic. In addition, adult ADHD can also cause other problems like difficulties in being able to organize day-to-day work, prioritizing tasks, being able to keep relationships with friends and family, and just being able to cope with everything that life throws at us every day. This can further affect people's self-esteem and self-confidence in being able to interact with others, in being able to function from day to day at work and within personal life.